So the first question, so I'm going to throw out, because of the title, I'm going to throw out some things that I've heard in the barbershop, and I want to see, just get an initial response. Oh man, don't get the COVID vaccine because a microchip is going to be planted in you. Who wants to address that first?
Sure, I can jump in. Um, I would say that that's not true. But I understand that in the beginning, before we had any data and you know, any information, how would you know when I say that that's not true? Like that you should believe that. And so I think that it's a fair thing for people to be concerned based on some of the history in this country that this vaccine might be used to monitor them in some way. But um, there's no evidence that that's actually ever happened. And this might be another question that you asked too, but I think what's important for people to know too is now, I think nearly 20 million doses were given out to the public, and there's data on how people did with those doses. So I think that that's what's important. And I'm saying there's more doses than that have actually been given out, but recently there was a big study looking at, hey, 10 million doses of the Pfizer vaccine have been given out, 7 million doses of the Moderna vaccine have been given out. What actually happened to people when they got these vaccines? And so I think that's important. So no microchips were detected in any of those studies. So I'm just going to put that out there. So that's good. And the other really important thing is that there were really, really low rates of people having bad reactions. And there were no deaths reported. So that's important. But there are people who can actually be allergic to things. Like some people are allergic to peanuts, for example, and they can have really severe reactions that we call anaphylaxis. But in both of the vaccines, that rate was really, really low. I think in the Moderna vaccine, there was only about two cases per million people who actually had that really severe reaction. And again, they were able to go to the hospital quickly. And that's why they monitor you after you get these vaccines to make sure that goes away. So that's really encouraging. And so I would say that people who are skeptical, especially about this vaccine, to just continue to ask questions, and then to ask what is actually happening, right? So before it was all just me saying, as a physician, we don't do that. But now you have some of your friends might have gotten the vaccine, and now we have data on all these people. And so I think it's important to think about those numbers too. So when I looked at those, 17 million, I think total that they looked at, I was really excited to see that there weren't any major events and no deaths. So that's where I'll leave it.
Dr. Morgan, I would love for you to chime in, or Chanel. I mean, have you heard?
Andrew,
Yeah.
I was a little slow to respond because you left the gate with that one, and that I just thought that
I
is so
come out swinging.
preposterous. That
I
is so
know.
I
preposterous.
know.
Chanel, there's the one guy who always comes into the shop and has something so off the wall that everybody in the shop goes, "What? Really?" And that's kind of where I was coming from with that. But I want to be more respectful and take it seriously if it can be taken seriously. I think that we have lost some of our faith in our government and in the institutions that we have to protect us. So that leaves a room open for people to think that the government would ever really want to inject us with chips so that they could keep track of us for whatever reason I wouldn't know. I just think that's simply not true. I do want to add on to something Dr. O said, which is that the experience as we have to date with the vaccine is it is incredibly, incredibly safe. If you think about it, there have been like maybe a dozen people who have had these allergic reactions. I bet if you were selling shrimp, if you're selling seafood, you're going to get more people in your restaurant allergic to the seafood than have been to the vaccines. I just think it's remarkable how safe they have been. And so, and the idea that the government's actually trying to inject us, I just have a hard time really not thinking of that as a wild conspiracy theory.